When you know that you can perform, when you know that you can be hard, when you know that you can stay hard and get the job done, that gives a man big dick energy. There's no question about it.
All right, everyone, it is interview time, and we are here with Dr. Sex Fairy, aka, or also known as the real name of Dr. Kanwal Bawa. And we are super excited to host her on our show to talk about big dick energy. So, you already heard a little bit about Dr. Sex Fairy in the intro, in the bio, but Dr. Sex Fairy, Dr. Kanwal Bawa, Dr. Bawa, can you please tell us and our listeners a little bit more about how you got to where you are today in the field of sexuality?
I took the scenic route to being Dr. Sex Fairy. I started out as an emergency medicine doctor. And if you ever watched the show Sex Took Me to the ER or Sex Sent Me to the ER, whatever that show is, all of that is true. All those crazy things really happen. And from sex toys still vibrating in people's butts to vaginal issues to penises with erections that weren't going away, I saw it all. And unfortunately, doctors don't really get much training when it comes to sexual wellness. And it doesn't matter that I was an ER doctor, Cleveland Clinic trained, highly trained. But my focus as a resident, as an intern, was always supposed to be strokes, heart attacks, those sorts of things. Sexual emergencies were never discussed, not really, beyond maybe a quick discussion on priapism. And I had to teach myself a lot of what I was seeing because there simply wasn't that kind of training. And people will surprise you with the kind of crazy things they'll bring into the ER and the kind of injuries that will show up. I mean, sometimes they might burn their vaginal area from topical creams, or people are taking these gas station supplements and they have issues from those. So it was a very interesting journey. And I was seeing a lot of suffering. I was seeing suffering in a way that one wouldn't normally expect it, from people in their early 20s to people much older. And initially, I even talked about this story when I gave my TEDx talk in May of this year. I thought I was being punked by one of my ER colleagues when I saw the chief complaint cannot get erection. And I saw the age, and it was a 20-something-year-old person. And when I walked into the room, he was completely slumped over. He was broken. And when I spoke to him, he told me that he had been dumped by his girlfriend because he was unable to perform yet again. And he was devastated. And it wasn't a joke to him, it was an emergency to him. And it really got me thinking about the gamut of human suffering. It's not as simple as we'd like to think it is. And not every 20-something-year-old who has ED not every 20-year-old who has ED has it because of a mental issue. Sometimes it could very well be a physical issue. And I think we are very, very judgmental towards younger people with sexual problems because we think, oh, that person must be crazy. There's no way a 20-year-old has any issues performing, yet here he was. So this happened more and more often, and it really changed the course of my career.
I think that, and this is, I don't want to go right into the big dick energy after something so vulnerable that you're talking about when people have issues and they come into the emergency room and the training for doctors is limited. As you said, that's hard. And there's a lot of shame when it comes to genitals, or if someone sticks something in their butt to investigate and it gets stuck. So I think next time we have you on, let's do ER stories about the things that you see, because it's something that, this is why we all exist, right? We're teaching people how to have pleasure and also what's not safe to do sometimes. Sometimes there's things that you shouldn't use in your bum, and it's okay if you have ED and you're 20. There's ways that you can work around it. And bringing it to the big dick energy part, which I'm so stoked that we're talking about, this big dick energy. And I have a deep respect for you being on the show and really sharing your vast knowledge, because this is fun. And we've never done an episode like this. So let's get straight to it, or let's go forward through it. What is big dick energy? Do you need a big dick to have it? Do I need a big D?
Big dick energy isn't just about a big penis. It's about that quiet confidence a man has. It's about being able to perform for his partner and also get pleasure for himself. It's not a one-way street. sex should not be just one person or the other person. Very often, there's the orgasm gap. We often talk about it. Women just aren't orgasming as much as men do. And it's a fact. It is what it is. Now, a man with BDE, in my opinion, knows that he can perform, knows that he can please, and knows that he can pleasure himself. And BDE is also about a man who feels that he doesn't have to be cocky, that he can be respectful, he can be kind, that, he's got what it takes without being a bully.
Confidence.
Yeah.
Confidence.
And no bullies. That I will get into that part in a minute. So just to clarify though, so big dick energy isn't about the cock per se or the size of the cock or having a big cock. So is it just an energy like, can pussy owners have big dick energy? And if so, what does that look like?
Absolutely. And I'll answer your question in two parts. I don't think you need to have a big penis to have big dick energy, but I do think that having one gives you more of it. It's kind of like when women get breast implants. A woman is just as beautiful, in my opinion, with smaller breasts, but when she's able to have cleavage in a bikini and strut, her stuff on the beach, she's more likely than not more confident. And I don't think that we should see it any differently for men. If anything, I think we're very sexist towards men when it comes to penis size, because men are humiliated sometimes for wanting a bigger penis, but we've normalized that conversation about women and bigger breasts or even Brazilian butt lifts. So I think we should be fair to men and, let them have that freedom. If they want a bigger penis, they should be able to get a bigger penis without being embarrassed and without being vilified. So yes, they don't have to have a big penis, but it sure helps. And absolutely, my friends, women can have big dick energy. I think 3 of us here have big dick energy, don't we?
April definitely does.
I concur. I think so.
Mm-hmm.
I don't know what it is, but I've been told that by my partner on a regular basis. He's like, dude, you're big dick swinging right now. I'm like, I am? I'm like, I didn't even know. And several other people, but I don't know. It's just, I think there's a confidence that is in the big dick energy. It can be in all of us at certain times and maybe all the time. I don't know.
And it, like when I think of you and your big dick energy, April, I think of also in your intellect and your wit. Like you are a very smart, intelligent person. You're funny as fuck.
And my inner frat boy comes out.
Yeah, inner frat boy. And so I guess like what I'm hearing is big dick energy isn't just about the physical body. It's about all aspects of ourselves that we're really confident in, but not in a cocky way where we're trying to like pretend like we're confident when we're really not. I think maybe.
Agreed. I think big dick energy has to be quiet confidence. Confidence doesn't scream. Confidence can even be a whisper. Confidence in somebody who knows that they have it. They don't have to yell from rooftops.
Yeah. Well, if people tell you like, I am so cool, you're like, yo, you don't have to say that. You can just let people know slowly with what you do, your actions. So, okay. So let's talk about this then. What is not big dick energy, but could also kind of mask itself as confidence?
A narcissist, for instance, a typical narcissist will appear confident, but I think a narcissist deep down is very insecure, which is why they feel the need to put others down. And that is not big dick energy. The big swinging dick in the room, in my opinion, isn't necessarily a good thing. I think big dick energy is somebody who is kind, who is calm, who is nice to people. Now, that big swinging dick is fine. But, very often when somebody says big swinging dick, it can have a negative connotation to it. Because it's like people with big trucks, for instance. People assume that somebody with a big truck, those big giant tires,
the lifted ones.
Mm-hmm. That, oh my God, that's a small penis issue right there. And, I don't know that that's necessarily true. I've seen patients of mine, park these massive trucks and they have big penises and they come to me because they want to be bigger still. And that's okay. But I think we can't assume that people with big trucks necessarily have smaller penises, just like big penises, I mean, men with big penises don't necessarily know what to do with them. So you've got to have it, you've got to know.
Yeah, that's an interesting point, actually. And I'm glad you said that, because a lot of society says, it's all just about the cock, and we're not talking about like the motion in the ocean, the human behind it, the energy, the connection, creating safety with your partners, and also skill and technique. And so it's not all about size and performance is part of it, which brings me to the next piece here, which I think you already commented on, but I want to elaborate on a little bit more. So, because you specialize also in erectile issues and ejaculatory control issues. Maybe I don't know if you specialize with that as much as erectile stuff, but do you think if someone is fully confident in their ability to be hard when they want to, for the most part, and to come when they want to and not come when they want to, for the most part, does that contribute to big dick energy?
Absolutely. So much of sex is about confidence. And when you don't feel confident about your performance, you're not going to initiate it. And you're not going to perform very well, even with oral sex, because you're just not as confident about yourself globally. When you know that you can perform, when you know that you can be hard, when you know that you can stay hard and get the job done, not be already soft before your partner's even fully turned on, that gives a man big dick energy. There's no question about it. Definitely. It's about size, it's about ability to perform, and also it's about how confident they are with other aspects of their life.
Isn't it true that you, like, as a person, even whether or not you have penis or not, or if it's a big dick or not, depending on the person, that there's like this chemical reaction that happens when people like flex off in the mirror that like raises your testosterone when you kind of, and women can do it too. If you're in a meeting space, you like get bigger and it makes other people feel a little smaller, and then you can flex off in the mirror and it raises your testosterone levels. I don't know if this is really a thing, but I've heard that flexing off, especially for like bro dudes, can make you feel like you're bigger and stronger and have a huge cock. So maybe if you have like ejaculatory issues, you could just flex off every day.
Well, you could flex off, but it won't help you when it comes to performing. So there is that. So you raised an important point. Women need testosterone too. In fact, women have about 4 times as much testosterone in their bodies than they do estrogen. And women need to make sure that their doctors are checking not just for estrogen levels, but their testosterone levels, that they're also checking their thyroid levels. Hormones matter, and it's not just about replacing one or the other. It's a balancing act, or at least it should be in theory.
I like the human hormone part where you're like, testosterone's not a dude hormone or a male hormone. It's like a human hormone. And Amy and I both have testosterone pellets.
Yeah.
So we know all about hormone like balance.
We love those pellets. And since you're talking about this and this episode, you didn't hear it, Dr. Sexberry, but in the intro, we answered a sex question for someone who hinted at wanting us to do an episode on sex post-hysterectomies. And this episode is about big dick energy. So I know it's a little different. But since we have you here, the doctor's in the house, and you just talked about, women and hormones. Do you have any tips? And I know this is, again, we won't go too deep down this rabbit hole, but for folks post-hysterectomy in terms of sex, and the person who had the hysterectomy, they once had a really high libido and now it's low to no, like what would be like your quick top tips for that?
Libido is a complex issue. And libido is, I think, as much mental as it is physical and chemical. So they have to make sure that they're in a good headspace. Menopause is a time of great change for women, and it can really mess with our confidence. When libido is low, it makes you feel like something's wrong. But it's kind of like a catch-22 situation, or like, a chicken and egg. What comes first, the chicken or the egg? So menopause is causing hormonal chaos, so you don't have libido. And then you have low libido, so you almost don't even want to bother because you have no libido. Does that make sense, what I'm saying?
Mm-hmm, totally.
So it's a tough situation. So libido is mental. We have to make sure that we are in a good space mentally, that we are not in toxic relationships, that we are giving ourselves the grace that we should, that we do something for ourselves, not just for our families, not just running kids around or grandkids around. It's also about doing something that nourishes your own soul. So mental, definitely. Secondly, chemicals. So we touched upon testosterone and estrogen briefly. And vitamin D levels, that's another major pandemic nobody's talking about, and it's a global issue. People have low vitamin D levels globally, about 1 billion people, according to a study I read. And those are just the people we know of. Think about this. Low vitamin D levels are going to affect your sex life too. They're going to affect your energy levels. So We said women have to make sure that they're good mentally. They have to make sure they're good chemically and then physically. Now, when you have low estrogen levels, low testosterone, all of that's happening, your vagina is basically drying out. I hate to be that graphic, and I'm not being derogatory, but let's face it, girls, that's what's happening to our vaginas as we age. Mm-hmm. So what can we do about it? Well, in today's day and age, there's a lot you can do about it. And you talked about menopause, but I'll mention a very important subsect of women, cancer patients, cancer survivors. So we assume that if we've had breast cancer or any other cancer, we can't do hormones. That's not actually true. We can do topical estrogen creams. We can do those things for ourselves. There's no reason to suffer. And remember, people will sometimes say to me, I'm not having sex, so I'm okay. No, but it's about more than sex. It's about your intimate wellness. It's not just about getting it on with somebody. Well, maybe you can get it on with yourself. That's not half bad, is it? Mm-hmm. So it's important to think about your physical health. It's important to think about how things are down there. You can improve your vaginal health with estrogen creams, and especially with some testosterone compounded in. You can also do shockwave therapy. I do a version of it that I call Bawa wave at my office. I've had great success with it, especially in menopausal women, in cancer patients. It's worked wonders. And of course, for men, it's been a game changer because blood flow is important. I always say when you flow, you grow.
Mm-hmm. I like that. You flow, you bro?
Grow, not bro.
Oh, I was like, you flow, you grow.
I said when you flow, you grow.
Yeah. Bro, she's
when you have good blood flow, you have good erections.
No, now I know.
Inner frat boys coming out over here. April has big dick energy, everyone. Don't forget.
Sorry, Dr. Sex Fairy. That was rude of me to think about burrowing. But I thought it was like in context to the testosterone balancing. And I have a research study that I just read that I want to share with you about the chicken or the egg scenario, because you said that the egg actually came first. I did some research and they discovered that the egg fucking came first. So
how did the egg get there?
So, evolution, sorry for creationists out there. And thank you, because I think you're saying in a nutshell, or I want to check in with you that there's hope for everyone and there are options for everyone, no matter what the scope of their life has been, and if they're dealing with medical changing surgeries or hormone shifts or aging. You don't have to have a dried, pruned up pussy if you don't want to. You can do things to help your cock have more energy and yourself have more energy. Is that kind of what I'm hearing?
Absolutely. And these are just a couple of things that can be done that I mentioned. I talked about shockwave therapy. I talked about estrogen therapy, topical hormones. That's just a drop in the ocean compared to all the things one can do now. And you talked about dried out, vaginas, and, penises are drying up too, because as men age and as blood flow reduces down there, men don't realize that things are going to start to shrink. And they come to me and they say, I don't know what happened. I've just lost a couple inches. What's happening? And especially after COVID, believe it or not, there was this whole subsect of men that were coming in saying, my penis is shrinking. I swear I'm not crazy. And then they did studies down at University of Miami and saw that, yes, COVID was causing endothelial damage and COVID was causing people to have ED at a young age. And then consequently, of course, when you have ED, you don't have good blood flow. And when you don't have good blood flow, your penis size will go down. And talk about taking a hit to your BDE there. Mm-hmm. That's not good for BDE.
Okay, so what can someone do if they want more big dick energy, but they don't feel like they have it right now? What can they do?
I think big dick energy is so personal, depending on the person and what their life situation is. For some men, just having a boys' weekend out, it's so hard to get their wives to agree to do that. They almost feel like, I better not say it. She's going to be so mad. But listen, if you need time with the bros, as we were just saying, maybe they need some bro time. Maybe they just need to do something for themselves. Maybe it involves non-surgical penis enlargement. Maybe it involves improving their erectile function, and that will give them BDE. So it really depends on the person. For a woman, for instance, BDE is just as important. Women may not have big dicks, but it's important to have big dick energy. So I think we need to do something that gives us pleasure, us confidence, and we have to own our orgasms as women. This concept of, I don't really orgasm. I just enjoy being with him. We need to stop having that lackluster mentality And we have to understand that we too can have orgasms, that you have to make the effort, and you can't keep blaming your partner either. Because I feel that we as women are a major problem when it comes to the orgasm gap, because so many women fake it. And if you fake it, you're never going to make it. And if you lie to him that you're enjoying it, what's he going to do? He's going to keep doing the same thing. So who are we helping? Not ourselves and not him.
When I think of big dick energy, I also think of like a fantastic lover who is really giving, and this, because you're saying a lot. What you said, I think is great, right? Like doing something for ourselves, right? So let's think of a man who's like doing things for himself. Like I like doing this for me. But then they've also cultivated, their skill and enjoyment in being a fantastic lover, and so there's a lot of like selfless giving, but it's not selfless because they're like kind of getting off to giving. Like that to me is more important than the big cock. It's more like, are you a pussy worshiper? Okay, big dick energy. Big cock, that's big dick energy too ish. But like, to me, it's more like the energy behind it, which
Agreed.
To a certain degree is probably easier to cultivate than making your penis bigger, is to learn skills and like practice them and to be a wonderful giver. But let's talk about the making your penis bigger. And we love penises of all sizes, everyone, small, medium, large, extra small, all the things. And we are very passionate about the fact that their big dicks aren't for everyone, and sizes matching up is important in terms of the people that you're having sex with. But you have something that is a non-surgical BAVA big penis enlargement procedure. What is this? And does it automatically give people big dick energy?
Well, I'd like to say it does give people big dick energy. Bava Big is my method of non-surgical penis enlargement. And I use two ways to do that. One, I take blood from people's arms and I process that into PRP or platelet-rich plasma. I then concentrate it further into PRFM, so concentrated growth factor from your own blood, and I put that back into the penis, into the outer layers of the penis. So I'm building collagen and elastin, skin proteins, which will make you thicker. And then I also use hyaluronic acid filler, pure hyaluronic acid. I don't do silicone-based stuff. I don't believe it's safe. I don't do permanent fillers. I use pure hyaluronic acid and I mix that in. And so you have the immediate improvement in size from the filler, and then you have long-term improvement in your collagen and elastin from the PRF element of it, from your own blood. So people end up with bigger penises, but it's also improving their own penis, if that makes sense, because they are actually making themselves better from the inside out. It's not just the filler, though the filler makes them feel pretty awesome too.
Have you heard of Scrotox?
Yes, and I do it at my practice.
Okay.
You do?
Because we did an episode on it. It was so fun. And I love that you do that as well. So how do you feel about Scrotox?
I think it's great. I think anything that is safe within limits and makes you feel better about yourself should be on the table.
I'm the same. I'm all for using the like technology of what we have currently for like doctors and Western medicine, just continuing to generate new avenues of ways to improve life, right? And it's put simply as possible as I can. So anything that you've heard here today, y'all, is about absorbing like the best self that you can be. It's not about having a big dick. I think Amy said that. It's not about having to be a specific way, because we're Shameless Sex. We don't want to shame you if you feel like you don't have big dick energy, but we're here to tell you that it's possible to get the confidence that you want and the life that you deserve. So that being said, we know you have a podcast, right? That is incredible. And you also have some other offerings. You are in Florida, I believe, but if people want to find you, work with you, etc., find your podcast, can you talk a little bit about how they can reach you?
Thank you. My podcast, Dr. Sex Fairy, is my pride and joy. I did not set out to be a podcaster. I just have patients all over the world, and they email and they call, and I just wanted to give them a way to get some good information, no matter which time zone they were in, without having to write 1,000 emails a day. And that's really how the Dr. Sex Fairy podcast began. And then, I built it and they came. I picked up a microphone and people just started listening. And that's really how it came about. And now it's heard in, I believe last time I checked, 14,300 cities, but who's counting? And so it's a lovely thing to see. So the Dr. Sexberry podcast, of course, is available everywhere podcasts are. And then they can also find me on drsexberry.com. And I have patients that I do virtual consultations with, in-office consultations, the whole 9 yards. Many fly to me. And then my TikTok, hopefully there'll be a TikTok, is Dr. Sexberry. It's a lot of fun. My TikTok is hilarious. And then there's Instagram, The Real Dr. Sexberry.
And you also have the bavamedical.com, right? As well?
Yes, bavamedical.com is my practice website, bawamedical.com. And my practice, Bava Medical, is located in Boca Raton, Florida.
Are you taking new patients?
Always.
Oh, very nice.
There's hope.
I love it. And we absolutely loved having you on talking about this big dick energy. I'm going to go flex off. Yeah. And know that I'm confident and ready for more. So thank you. I really want to thank you, Dr. Sexberry. I love this name too.
Me too.
Hopefully that you didn't mind that we called you Dr. Sexberry the whole time and not Dr. Bava, because it was more fun.
No, really. I think that's awesome, because the reason I picked Dr. Sexberry as a name is because it is funny. It is something that takes the edge off. Sexuality, sexual medicine, it's not an easy topic. And people get so nervous about it that when you call yourself Dr. Sexberry, it's disarming. It's not the long white coat necessarily. They see you as a human being or, a silly character. And, I ask very tough questions, and I think it makes it a lot easier, especially in my office, to get answers if you don't necessarily behave like a regular, typical doctor.
I love that. I love the humility. And I think that's really important when it comes to sexuality, especially in the medical world, because like you said, it's super edgy and scary for people. And like you said earlier, a lot of doctors who aren't highly trained on sex or don't talk about sex or are uncomfortable doing that. And so it's awesome that that's your specialty. And you're doing that so well. And I've called myself the lube fairy because I work with Uber Lube. But since you're Dr. Sex Fairy, I think I should become the love leprechaun. What do you guys think? No,
aren't you too tall to be a leprechaun?
Can't leprechauns be over 5'9"? No,
I don't know. I maybe you could be whatever you want to be.
Oh, thanks, Chip. You do you.
Well, we're big dick swinging over here, no matter the size. If we're a leprechaun or whoever you are, we hope that you enjoyed Shameless Sex and hearing from Dr. Sexberry. Check out all of her work, and if you're in Florida or you just want to fly, you can go and get some of her amazing. What would we call it? Like services. Yeah. Performative elements. I don't know. I don't know. What should I call it? Help me.
Well, I just say I do sexual transformation.
Oh.
So whether you want a bigger, harder penis or you want a tighter, wetter vagina, I'm making dreams come true in South Florida. So come on over.
Okay, that was way better than what I said. So I love that. So all of you out there listening, we appreciate you so much. Please review us on your favorite podcast app. It helps more people find folks like the Dr. Sexberry and helps them have bigger dick energy every day of their lives if they want it. All right. We will see you next Tuesday, y'all. Ciao for now.